All right, so as I mentioned, our topic for today is an overview of charge posting, where I'm going to walk you through the basic process of posting charges. And that will be from an overview of a journal, a daily journal, through actual posting of pending charges, and walking you through the flow of the actual charge entry window, the ailment screen, all the way up to allocating, when applicable, a collected payment. Okay? And then towards the end of the training, we'll take a brief look also at the journal report as well. So where I actually want to go ahead and start is looking at your toolbar icon. Obviously, for someone to post, you have the rights to post. So in comparison to yesterday's class where we really went through the setup part of it, we won't be focusing too much on that today. Today is strictly an end user training. But obviously be mindful that in order for you to post charges, you have the rights to do so, okay? As well as payments and journals. We'll talk a little bit about the journal more in just a second. So the first thing I want to mention to you is your toolbar icon. For the most part, you're going to have a stationary user toolbar icons. Okay, right off the bat, as a default, you're missing an icon. So if posting charges, posting pending charges is something that's part of your role, there's an icon there that you're missing if you've never touched your toolbar. Okay, some of the icons that we have here that are posting related can be, for example, the blue man. I can actually post charges from there, and I'll show you how to do that or remind you how to do that. I have the icon, which is strictly the square dollar sign icon, which is strictly my charge posting module. But what we're actually missing is the pending charges icon. So for those that do not have the pending charges icon currently, you most likely follow these steps. You probably go through financial charges, pending charges. So there alone you have like about 3 clicks there. So I'm going to walk you through the steps of actually adding the pending charges icon. To do that, we're going to come over here where it says Options, the Options menu, and we're going to go to User Toolbar. And this is per user. So you each would have to do this when you're logging in or have logged into Intergy. So what we see on the left is all the icons that are available in Intergy. And what you see on the right is how your toolbar currently looks like. These are the icons that I currently have in my toolbar. The preview of my toolbar will always be down here. So on the far left, what you're going to do is search for the one that says Pending Charges. To add it to your toolbar, I'm basically going to move the icon from left to right. So I'm going to highlight the icon that says Pending Charges, and at this time I will press the Select button. So again, that's going to move it from left to right, and now my Pending Charges icon is on my toolbar. Okay, and that's obviously a quicker step to get there if you in comparison if you did not have it. To remind you also, we can rearrange the order of the icon. So if I highlight Pending Charges, if I highlight that new icon that I've just added, I can use my up arrow that's over here to the right and rearrange my toolbar icons. So if let's say I work in check-in and I work in the checkout department, I work in registration and I also work in checkout. Perhaps some of those icons in each one of those roles may be different. So you can rearrange your toolbar so that you can keep your icons together if you wanted to. So I'm going to move this one right next to my charge posting icon so they can be side by side, just to show you an example of that. So you can just rearrange it however you prefer. Okay. Now that I'm done customizing my toolbar, I'm going to go ahead and click OK and take a look at my toolbar now. So now I have my newly added icon. It says PND $. That's your pending charges. Okay. Moving on, the next thing I want to talk about is the journal. To give you a high-level explanation of the journal utilization. To access journals, it's in your financial drop-down menu. So you would go to Financial Journal Management. The purpose of a journal, like imagine the journal being an electronic file, an electronic manila folder that's going to capture all the charges that you post and all the payments that you post. So if you're collecting money on a day-to-day basis, you're going to have access to the journal. If you're posting charges throughout the day, you're going to have access to a journal because you're going to be associating your posted charges and your posted payments to a journal. You have to have the rights to journals. So it is based on user security. So if you are a staff member or your staff moves around from location to location and works in various front desk departments, be mindful that that user is going to need access to that journal. Okay, so being able to use a journal is based on security. You have to be given the rights to it. And it also depends on the centers, the number of journals. You know, it might be one per location, or it might be one per location per department. What it typically will not be, or usually not be at all, is one per user. So as far as the journals go, the rules of the journal is that it's typically one per location. If you're one of the more smaller sites, if you have various departments within that one location, then it might be even broken down further that way. One per location, one per department. Also, something else about the journal, it's one per day. So if I work in the pediatric department, I'm going to have my journal. My department of 5 people, let's say, will be utilizing the one journal for that day for that department. Okay? So under Financial Journal Management is where you will see the journals that either have already been created for the day, open for the day would be the actual term, or we can actually go and open the journal for the day. Now, who opens the journal for that day will also vary based on your center workflow. Typically, my experience visiting throughout various centers is basically whoever gets there first for the most part. Some other centers just have management created. Other centers have where the user can create the journal for the next day. So while I'm closing the journal from today, I can go ahead and already open the one for tomorrow. That's one option. But typically, first thing in the morning, the journal is created. And this is actually where it's done. So if we look at the journal management window as we have here, there's an open tab and there's a close tab. So the open tab is showing me the journals that I have access to that are already open. So as you can see on our training database here, we have a journal named General that is already open with today's dates of service. The reason I don't see a journal from the past is because another rule of thumb is that journals need to be closed daily. So the journal, again, for the most part, is opened first thing in the morning, created first thing in the morning, it's utilized throughout the day, and then at the end of the day, somebody needs to close that journal. Okay, so at this point, this journal has already been opened and it's ready for me to use. My closed tab just shows me the journals that have been closed from prior dates of services, where I can always reference back. I can always go back to those journals if I wanted to take a look at them if I needed to. So back here on the Open tab, It tells me the date of the journal, which is always the current date. It's always today's date for the most part because we're creating them daily. It tells me if there's any active users. So if there's anybody actually posting to this journal right now, posting a payment, posting a charge, it might tell me that there's actually somebody in it right now by displaying a number in that active user. And that's also a visual cue for the person who's about to close the journal. I can see somebody's in it, therefore I should not be closing it. Unallocated payments. So if we have collected money in this journal, but we have not properly allocated that payment, it will show me that I have an unallocated payment. And then we have the status. So there's a couple of different statuses here. For example, if right now it says open. What an open journal status means that yes, it is an open journal that was created today. But because it says status open, it means that there's already activity in there. Somebody's already been posting payments and charges for today. When you create a new journal first thing in the morning, the status will say no activity. No activity means that it is an open journal because I just created it. However, nobody has posted anything yet. So it reads status no activity. So those are the two different statuses that you'll see. Open, when you have posted something, no activity when you have not posted anything. Okay. So again, a quick recap here. We are under Financial Journal Management. That's the window that I'm looking at right now. I can clearly see that my journal has already been created for today, therefore my step is done. Typically the rule of the journal as well, it's only one per day. So I can no longer create a general journal with today's date. It's already been done. In the event that I did need to open the journal for today, it would be this new button here to the left. So I would click on new, pick the journal name. Again, the journal name will probably be the name of that location or the name of that location and department. That's typically how it's defined. And then the post date. As I mentioned, the post date, the date of the journal is typically the current date. You want to be mindful when you're going like from a Friday to a Monday, or you have some holiday breaks in between. The system always tries to create the journal for the next day. So if your center does not have Saturday business hours, it might accidentally try to create a Saturday journal when in fact today's Monday. So be very mindful with the post date that in fact it is the current date. An easy step here, and it pretty much applies to many of the date fields in Intergy. A shortcut for a date field, if you want to put today's date, the shortcut on your keyboard is the letter T, the T keyboard key. So if I press T here, as you can see, it puts today's date on there. So that would be a quick way to put that date. Okay, you would click Save, and your journal would be created. Okay. Towards the end of our training, I will be coming back to journal management to really talk more about the closing of the journal step, and we'll take a quick look at that one. So I have an open journal, and this journal will remain open throughout the day for me to use or anyone that has the rights to use the same journal. And then at the end of the day, it will need to be closed. Okay, so moving right along to the actual charge posting step. There's various areas where you can do the same thing in Intergy. I can post charges, which will be mostly the step I'm going to take in today's class. You can post charges via the pending charges window, which will probably be more of our recommendation there. You can post charges directly through the charge posting window. So if I click on the charge posting icon itself, I will pull up the patient's name, and I will be able to post any pending charges from there also, or do any manual posting if your center does that as well. And I can also post charges from the blue man icon. I can also do it from patient information. So if you're part of the checkout window, let's say, and you were already in that patient's account, if you're already in that patient's information, I have a little $sign there that allows me to post the charges right from here. So there's various areas where you can do the same thing. I do want to remind you though, or make a note that if you are posting charges through patient information, which is where we are right now, or you are going directly through the charge posting icon, which I'm pointing to, if your method is to post through there because the patient is in front of you and you rather take that step, that's fine. However, I want you to be mindful and be reminded to always be looking at pending charges throughout the day. If you're working in the checkout department and you're about to post that patient's charges before they leave, be mindful that we're really at the mercy of the clinical staff, of the clinicians. We're at the mercy of them dropping their charges. That's the term that we use on the EHR side when the provider or the support staff indicates the charges of the services that were rendered that day. We were at the mercy of them dropping the charge in order for us to post it. When the patient's in front of you, ready for checkout, all the charges for that day may not be readily available for you to post. So for example, that medical assistant, maybe an hour after the patient leaves, did the charge for the patient's nebulizer treatment. Meaning you have already posted the patient's charges while they were there with you, but now an hour later something else came for that patient. And you may not have known that at that time when you were posting the charges. It is always best practice to post the patient's charges once everything's been dropped, especially if it's the visit code that's missing. So I'll recap some of these tips as I go along. But the pending charges window will always be a holding area of all charges that are waiting to be posted, which is mostly where I'm going to do the training off of today. So again, some areas where you can post charges, charges would be patient information using your $sign. You can use or go straight to the module itself, which is the charge posting icon. But we're going to go ahead and go through the pending charges icon directly now that we have it in our toolbar. So the pending charges are charges that came from the EHR side. Okay, so we're not technically manually posting charges here, as we may have done back in the day when we were on paper. But the provider and the support staff, and by support staff, I'm talking about your RN, your MA, your LPN, they are responsible for dropping charges as well. So on the EHR side, my provider is going to indicate what is the code that what is the visit code that we're going to bill today. My support staff is responsible for indicating on the EHR side the services that were rendered today. So if the patient was given an injection during the visit, that's a service that was rendered, and it's a charge that needs to be posted. Or perhaps the patient had blood work done, or a nebulizer treatment. Every service that was provided, whether it is an actual billable service or not, all services that were rendered must be a posted charge. So what we're looking at here again are the pending charges that come from the EHR side that are waiting to be posted. And this is something that needs to be reviewed and completed on a daily basis. You should not have pending charges. We're on our training database. Okay, we are in our training database. This is all fake data. But look at some of the dates of services that my training database has here, going back to years. And that's something that we should not be seeing on a live, real center database. We should not be lagging the way we post. If the patient was seen on last week Friday, we would hope that by now that charge is posted. If you're waiting on something for X reason, then perhaps that's the reason why. But we should try our very best to post as quick as possible. Anything that's sitting here, these are charges that are waiting to be posted. And if it hasn't been posted, it means it hasn't been billed. And obviously that also means in the long run that a payment has not been received. So the longer we wait in posting these charges, it'll be more of a delay of receiving that payment. And some of these insurances will deny a claim if you take too long. And that's called timely filing. So it should be it is a best practice, and it should be part of your workflow to review pending charges and post pending charges by the end of the day. And that is the ideal situation, that my pending charges window is empty by the end of the day. Now, is your provider going to work after hours at the end of the day when after business hours and catch up on such items? It may happen. So when you walk in tomorrow morning, all of a sudden you have a pending charge from yesterday. It may happen. But what are you going to do? You're going to make sure you post that right away. We don't want to keep it there past that. Okay? So again, the takeaway here is to ensure that your pending charges is monitored on a daily basis. You have to review on your pending charges every day, post every day. We want to make sure that this is clean by the end of the day. There are various filter options here. The system usually defaults by the encounter number, so that's the order that it would be in. If you're at the checkout window and you're posting charges as the patients are leaving, maybe the date option might be a better option there. As you can see, when I select date, I'm looking at the most current one first. So that might be a better option there. If you are working off of the older ones, if you're working on the older ones first, then encounter number would be the way to go, because encounter number will always look at the oldest one first. You have the option of sorting by name. So if the patient was in front of you and you're ready to do their checkout, I can come straight to pending charges and search for the patient name through here, if that was the case. And as you can see, you have other options there if you wanted to filter further. Okay? So for this particular example, I'm going to actually post the first patient that we're looking at here. So my test patient for today's training is Harry Potter test. I can see the encounter number. So just to give you a high-level understanding of that encounter number again, it's system generated. So once the patient arrives for their appointment, once we have acknowledged that the patient is here for their appointment in Intergy, the system will automatically generate that encounter number. And that encounter number is based on the appointment, right? Based on that patient's appointment. And that encounter will travel essentially with the patient throughout that visit. So by the end of the visit, ideally, this encounter will have charges associated to it, maybe even payments if you selected payments, or collected payment, I should say. And we should also have clinical data on that encounter. So that's what the encounter number is. It's system generated, and it's eventually the encounter that we're going to post our charges to. It tells you the date of service, the time. So date and time typically will be the date of the appointment and the time of the appointment. Patient's name, the provider that their appointment was scheduled for, the location, the reason for that appointment, the insurance carrier and plan that the patient has, and any department and finance information. So what I'm going to go ahead and do here is select my patient. I'm going to select the patient that I'm ready to post. So I'm going to simply highlight that and come down here to post pending charges. If you're more of a double clicker, you can very well double click there as well, and the same thing happens. If you want to do right-click, you can right-click Post Pending Charges also, however you prefer. So I'm going to go to Pending Charges, and the system is prompting me to open, or to select, I should say, my journal. So, and some of you that may be familiar with this process that we're training today is probably wondering, well, I usually don't get that box. If you don't normally get that box, it's because you probably have the rights to one journal only. The reason I'm getting this box is not because I don't have a journal. The reason I'm getting this box as I'm posting my first charge here is because I have access to more than one journal. So take a look here on the left. I have access to 4 journals. So Intergy is double checking which journal should it use for this charge that I am about to post. It is definitely not the last time that you're going to be able to review this information as you're posting. You will be able to, but it is the first time. So I'm going to go ahead and select the journal that this charge goes to. So for the staff that move around from location to location, be mindful of this. You know, don't be quick on your fingers. Don't accidentally select the wrong journal. It's definitely not the end of the world. If the mistake is caught that same day, it can be corrected, and I'll briefly show you that at the end of training. But be very mindful. Don't be quick on your fingers. Be very mindful of the journal that you are about to select if you do get this prompt. Again, if you only have the rights to one journal because you only work in one department, one location, then most likely you'll never get this window. Okay? So I'm going to select the journal that is associated to the charge I am about to post. And then I'm going to click OK. Once I click OK, I'm going to get the Pending Charges window. So it is showing me all the pending charges that I have for this patient, waiting to be posted for this patient. So this patient has 5 line items, 5 procedures that are waiting to be posted. I have what we call an F code here, and I'll talk to you about that in just a second. I also have here a nebulizer treatment that's waiting to be posted. I have an E&M code, an evaluation and management code, which is essentially a visit code. Here is another F code. And here is another E&M code. So for those of you that might be familiar with this process, off the bat has already found a discrepancy there. So as you can see, each one of these line items is a procedure that needs to be posted. Each line item has its own diagnosis code or codes, all dependent on how it comes from the EHR side. If you look here at the bottom, it says created by. It says IEHR. That means Intergy EHR. So these charges, which is what a pending charge is, these charges came from the EHR side. Okay? So at this point as a poster, I am just ready to post what is already indicated for me in this visit. I have a couple of options here to the right. I can select to post what I have highlighted, or I can choose to delete that pending charge. As I mentioned in yesterday's class, there's definitely a golden rule to user and security, meaning the access or the rights that a user has. And typically deleting is not an option. End users should not, or for the most part, users should not have the rights to delete in Intergy. The way that Intergy behaves with deleting 99.9% of the time, is that it leaves no trace. It leaves no trail. If something was deleted, it will look like it never existed. So therefore, that is the reason why users should not have the rights to delete. However, here we have the rights to deleting pending charges. And this we could trace. Intergy does have a capability. It has a practice admin capability, meaning you have to be a practice administrator. It's something called an activity audit log. So it's kind of like a report you can run to see who is doing what in Intergy. And I can actually trace a deleted pending charge. Okay, so just to remind you, if I do have any managers on the call today, upper management or a supervisor or higher, be mindful that there is something called activity audit log, whether you have the rights to generate it yourself or somebody can generate it for you. It's called the activity audit log, and that is to be able to trace a deleted pending charge. Now, the reason that it is okay for someone to be able to delete a pending charge is in the event when there is an error. Okay, so my provider here, my provider David Ford, has accidentally dropped 2 E&M codes. So I have a 99213 right here, and it has 3 diagnosis codes associated to it. And I have another 99213 right here with only 1 diagnosis code associated to it. That's where my delete button comes in. Now, however, I'm not here to tell you to just delete 1. Okay, for the most part, in our centers, for the role of the poster, which is the step we're doing now, a lot of our centers do not have a certified coder in that role, a certified biller and coder. So unfortunately, I'm not here to tell you to pick and choose which one needs to be deleted. You will not be able to take it upon yourself to choose which one needs to be deleted, which one needs to be remain. So it's not like I can say, if I don't have that level and that if I don't have that authority in the department to actually be able to choose what to delete or that training level as a biller or as a coder, I'm going to have to rely on my provider. So if I'm a poster with no billing and coding certification, and I don't have that ability in my center, I need to actually go back to the provider. I need to go back to the provider, and the provider needs to tell me which one to keep, which one to remove. I'm not just going to assume, well, let's keep this one that I highlighted because it has 3 diagnosis codes, and let's delete the other one because it only has 1. I cannot make that assumption if I don't have that level of training. Now, how do you go back to the provider? A lot of our centers will task the provider. I can send the provider a task so they can then let me know what corrections I need to make. Okay? Or maybe the provider has not dropped their E&M code yet. I'm looking at this list. Let's say those 99213s were not there, and all I had was my F codes and my nebulizer treatment. If that was the case, that's a red flag right there, especially if it's now the next day. I can task my provider and remind them to drop their E&M code, to drop their visit code. It has to be the provider to let us know what level of coding will be that day. It will be their responsible. Whether that is mostly tasking or verbal communication, whatever the means may be, usually tasking is the way to go. I have to rely on the provider to tell me which one to keep, which one to delete, and if I am missing the visit code, I have to wait. I have to wait to post this pending charge until I actually have my visit code. Okay? So we're going to pretend that the provider has let us know which one to remove, which one to keep. So let's say the provider came back and said, stay, because this can happen, and some of you that are familiar with this step might know what I'm referring to. On the EHR side, just to give you a visual of that, on the EHR side, dropping charges is one click. And if you have providers that are click happy or they accidentally double clicked instead of clicking once, it can easily drop that charge twice when they really didn't mean to. And it could happen. Another reason why it could happen is when the provider is not properly trained on how to associate multiple diagnosis codes to the visit procedure. I've seen it happen where the provider wants to associate 3 different procedure codes to the visit, does not know how to do that, and they wind up dropping 3 visit codes instead of 1 with 3 diagnoses. Okay? So it could be a training issue where we need to educate the provider on how to properly do that. It can be an easy mistake, like I mentioned, that they accidentally dropped more than 1 and they did not mean to do that. To give you another visual there is if they have to hit save. They have to save the charges that they have dropped in order for you to see it here in pending charges. Once they save it, it becomes grayed out for them. They will not have the rights to edit if they then realized they made a mistake. So if Dr. David Ford accidentally dropped 2 99213s like you're seeing here in our screen, and he saved it and then realized he made that mistake, the provider should have communicated with you, whether it's verbally or via task, that he made a mistake and which one to remove. If he or she doesn't do that immediately, then he's going to, obviously it now falls on you having to find that out. So be mindful of that the provider cannot make that change on their end if they have saved it. It's now on you to confirm which one to delete, and you'll be able to delete it on your end. Okay, so I just wanted to give you that understanding. If you were not very familiar with the EHR side, I wanted to give you that understanding how it actually got here, how pending charges actually gets here, and some of those common scenarios that you may come across. As I mentioned, after further review with the provider said that we can delete the second 99213 code that only has 1 diagnosis. So all I'm going to do here is simply highlight it and press delete. The system will then prompt me to confirm that I actually do want to delete. So I'm going to go ahead and say yes to that. And because I did that, there is a trail. I'm leaving a trail that I just deleted that pending charge. So I went from 5 procedure codes to 4. Okay, and as you can see, they're not in any particular order on your end. The way that it gets dropped, the way they actually pick it on the EHR side is how you see it here. Okay, now I'm going to go ahead and talk about another best practice here, another recommendation. Another recommendation here, and these are some basic posting 101 tips that I'm going to mention throughout our training, is to always post the E&M code first. Is the E&M code the first one on this list? No. My 1038F is the first one on the list. So I don't want to actually post that one first. I don't want to go in the order that I see it. I need to go and post my visit code first. What you typically will post after the E&M code is the procedures that were done that day, like a nebulizer treatment or an injection. The codes that you're going to post last are the F codes, or the ones you see with the letter F at the end. The F codes that you are seeing, for the most part, if your providers are, if you're posting these F codes, is because we're trying to meet HEDIS measures, HEDIS. And these HEDIS measures are based on these F codes. Therefore, the insurance is going to be seeing these F codes via the claim information. So you start with the E&M code first. You then move on to procedures that were done that day, whether it's lab, injections, nebulizer treatments, etc. And then lastly, your F code. So that's the order you really should be going in. So to post that charge, I'm going to go ahead and highlight it. Remember E&M first, and then press select. Okay, now that I have selected that code, the first thing I am seeing is the ailment. And the word ailment, for the most part, has nothing to do clinically. It's not talking about symptoms or conditions. The ailment here is really for billing purposes. It's additional data that goes out on that claim and gets billed. If you're comparing, remember this is I want to mention this is our training database, and we have it set up to the basic windows that we're going to see during posting charges. In your organization, you might have a different pop-up window that comes up now, maybe to review the patient's insurance coverage, or maybe you're working with referrals and you might get an additional pop-up about referrals. Ultimately, it's all based on your organization workflow, but what you're going to see in today's class is the basic windows for charge posting. So after selecting my pending charge, the basic next step would be to answer the ailment screen. If you're new to posting charges, if you're new to Intergy, another golden rule here, because Intergy does give quite a few pop-up windows as you go through some of these processes, a recommendation would be to look at the header of your window. So if I'm looking at this window and I'm not very familiar and I'm not sure what I need to do here, always read the header. And reading the header kind of guides you to what Intergy is asking for. So it's asking me to select an ailment. The rule of the ailment is that it's one per encounter. So I'm not going to use any of the existing ailments here from prior data services. I'm going to have to create a new ailment, because this is a new encounter, this is a new visit. So I have a few options over here to the right, and best practice recommendation is to click New. So I'm going to create a new ailment for this encounter. Now remember, I'm not talking about a new ailment per procedure. I have 4 procedures to post here. I'm not going to create a new ailment each time. It's 4 procedures for the same encounter, for the same data service, therefore I'm going to create one ailment. Okay, and you'll see a little bit more what I mean about that as we go along. So I'm going to go ahead and click New here. And now I'm looking at my ailment window. I know it looks like a busy screen, but for basic medical office procedures that we are posting, such as a family practice visit, a peds visit, there are just a couple of fields here that you'll need to worry about. The additional fields that really vary, dependent of the insurance, dependent of the procedure, are fields such as referring provider, or authorization number, or admission date. Those fields will only be applicable dependent of what you're actually posting, depending on the encounter itself. So the 2 fields that you'll really need to worry about as a minimum here while you're posting charges is description and facility. Just those 2 fields. Description and facility. Description is actually a free text field. So you're going to type it in. There's no drop down there. For the most part, the recommendation here for description is the location, the abbreviation of the location, meaning I should say the department, the abbreviation of the department, and data service. Also, there's some centers that also put location and department. So let's say I work for Health Choice Network in the PEDS department. So Health Choice Network is my center, but I work in the peds department. Or I should say, let me rephrase that, this service was rendered in the peds department. So I'm going to type in HCN, and then I can put peds next to that. If you rather use all caps, that's good too. I've worked with some centers that maybe just have one location, and they put FP for family practice. Okay. And then next to that, you're going to put the data service. You can put 2018, or you can just put 18 like I did. Okay, but essentially you're going to have to type in the description. You're going to tell me the department, location/department, or just location, or just department of where that service was rendered, and the data service of that procedure. Let's say you're working on prior data services. So today's the 31st, but you're catching up. You're catching up on your pending charges from last week, let's say. Okay? A little trick here is that you can move your screen down. If you move your ailment screen down, it kind of will expose the window in the back, and that will tell you what your data service is. So if I'm not sure what date I'm about to post, I can look at the back and then know which date to type here. It needs to match. And again, my facility, my location goes here, my facility name, the facility, the location where this patient was seen. So those are the two fields you really need to make sure that are filled out. Again, the other fields that seldomly are used, and it really all depends on the insurance. If the patient is a Medicaid patient, or it also depends on if there's an authorization number for that patient to be seen. Perhaps the patient is only seeing you for OB services and there is an authorization number. Or maybe this is a hospital visit and you need to put admission date. It all depends on what you're posting. But day to day, for the most part, it's just description and facility. Once you're done filling out that ailment, your next step is to press Save. When you press Save, the window does not close. So your next step at this time would really be to click the Close window. So now you're back on the actual, or you're actually officially now on the charge posting window. And as you can see, almost everything is done for you. So if you're quick on your fingers, and this is something that you might do day in, day out, all day, you might just go straight to add here and start posting. But you remember, if you're quick on your fingers, if you're not really looking at what you're posting, that's where the mistakes can happen. So my recommendation to you as a poster is to review the window first before you move on. So I'm going to kind of work counterclockwise here to talk about what we're looking at before we actually take the next step. So I'm going to start over here on the top right-hand corner, and as I mentioned, work my way counterclockwise. So what I'm looking at here on the top right-hand corner is my journal. So remember I got that pop-up that says pick the journal? Well, because I picked the general journal for today, that's why it's indicated there. So if I'm a user, like I said earlier, if I am a user that posts charges from different departments, different locations, I always want to take a glance at that corner to make sure I'm on the right journal. Because if I'm accidentally on the wrong journal, this is a chance that I have to change the journal that I'm about to post to. So all you do is click on that drop-down arrow and change the journal. It takes 2 seconds to just look at that corner and identify if you're on the right journal or not. Towards the middle here, on the top middle, we have encounter number. So this is the encounter that we are about to post. So remember, when the provider dropped his charges for that visit, the charges are now associated to that encounter. Therefore, we are now posting that encounter. And the date is the date of that encounter, the date of that appointment. Here is the ailment that I just created. This is the ailment that I just created. If I want to go back into the ailment that I just created, I can click over the word ailment. The word ailment is a hyperlink. Anything that you see underlined in this window is a hyperlink, meaning I can go to it. So I can click on the ailment and maybe edit if I needed to. If you accidentally picked an old ailment and did not create a new one, I can then click on my drop-down arrow and click New here, if that was the case. So again, if you wanted to edit the ailment, just click over the word ailment. If you want to create a new one because you forgot to do that, then you click on the drop-down arrow. One other thing on the ailment before I move forward. I talked about creating a new ailment by using the New button. As you can see, there is a quick New ailment button there, and that's one that we want to stay away from, refrain from using. We do have limitations there. We are missing quite a few fields there. So our recommendation is not to use a quick New ailment. It's always to go through the New process. Referral number field, if your organization is utilizing the referral module in Intergy and you have patients that are referred to you, that will be called referral in Intergy. If I am tracking referrals of patients that are coming to me and there's an authorization number involved, I can actually associate the referral number to this visit if that was the case. The provider name, the service center, the date, the start date, all these fields that I've just gone through right here, service center, provider, start date, all that came from my encounter. And my encounter came from my appointment information. Right above the start date, this is the insurance selection. So the information as a poster, the information you are seeing here is however the patient is the information based on how the patient was registered. So if you are someone that just works in checkout and you're posting charges, but you're not actually doing registration, then you're at the mercy of the person who registered. You are depending and counting that the patient's registration is valid. You know, the proper eligibility verification was ran, and that the patient's coverage in Intergy is actually correct. Because however they are registered is how we're going to see it here while posting. Okay, so if we look at this patient's insurance, we can easily see that they have two insurances. They have a primary and they have a secondary. The way it looks right now is that this charge is going to be billed to both. It's going to go to the primary first, and then it's going to go to that secondary. Meaning that this patient, during registration, this patient was assigned two insurance coverages. They were given a primary insurance, and they were assigned a secondary insurance. But if we look, and eventually in your center, you'll learn some of these insurance codes as you go. But I can easily tell you right now that on this example, that secondary is a dental insurance. And I did that on purpose here for our training environment. Now, how can I actually see what the names of those insurances are? Well, that's where this select button comes in. So I'm going to go straight to this select button right here. And I can now see what the name of the insurances are. So for this data service, for this charge in particular that I'm about to post, it says that it's going to be billed to Medicaid first, and then it's going to be billed to Medicaid Dental Services second. So in registration, yes, the patient has Medicaid. And in registration, yes, the patient has Medicaid Dental Services as insurance plans. So as a poster, You need to have the basic knowledge or know that we are potentially making a mistake here if we continue. What we are posting in today's class is medical charges, a medical visit, medical procedures. So therefore, a dental insurance is not applicable. Okay, so this is where I can correct this. It is always recommended that when the patient is registered in Intergy, that you assign coverage to the medical insurance plans, unless it's a dental only patient. But if the patient comes to you for medical services, dental services, and maybe they're part of specific programs, like maybe a Ryan White program, that's going to be all the insurances that they'll be registered with, all the insurance plans they'll be registered with. But one of the best practices or a recommendation would be to only set primary and secondary as medical plans. You'll have dental there to be used, or you'll have behavioral health coverage there to be used, but they won't be set to primary or secondary essentially. Okay? So at this point, as a poster, again, we have to be mindful in what we're doing. We have to take our time in what we're doing. We don't just want to quickly start posting. So I have identified that this patient has a primary and a secondary. By looking at it, my secondary is dental. So now right off the bat, I know I cannot use that insurance, that secondary insurance for this charge. Again, I am posting medical charges against a dental insurance. That's not right. So this is what you're going to do to remove that secondary coverage from this charge. Again, you're going to press the select button. You're going to highlight the one you do not need for this charge, and you're going to press remove. Now I'm not removing it from the patient's registration. My patient's registration still says they have primary and they still have dental as secondary. All I'm doing by removing it here is removing it from this line item, from this procedure. Okay, so I did remove, and now I'm going to go ahead and click OK. So now it says that for this procedure, for 99213, we're going to bill Medicaid as primary, but that dental one, it's there in the background, and it says not used, meaning I'm not going to use it right now. You have other buttons here. Default means to put it back how it was, to leave it as primary and leave it as secondary, to leave it to however the patient was registered. And then you have none. If I press none, that means the patient is self-pay. So if I press none here, I'm not actually billing any insurance for this procedure. When the patient is self-pay, the system is going to look at the patient's sliding fee, and it will adjust any balances, it would adjust any procedures to what the patient's sliding fee is. It's no longer looking at an insurance plan. So I'm going to go back to removing this dental plan for this data service. Okay, so now this is how it's going to look. So as you can see, I could have just gone straight to add and start posting here. But so far, I've had to possibly make a couple of changes. Maybe I'm on the wrong journal and I've caught a mistake here for this insurance. If I was quick on my fingers and posting, then I would have gone with posting these charges to the wrong insurance plan. And then we're talking about denials, unnecessary denials, etc. All right, down here we have the procedure code. This is the charge that the provider dropped on the EHR side. And the provider will also indicate the diagnosis codes. So my provider selected 3 diagnosis codes for that procedure. Okay. Again, as a poster, kind of like what I mentioned earlier, if my role is to post charges, however, I don't have the training knowledge, I'm not a certified coder, I'm not a certified biller, I cannot take it upon myself to rearrange these diagnosis codes. The provider is the one that said that diabetes is the primary diagnosis. The provider is the one that says that hypertension was a pulmonary diagnosis. Pulmonary hypertension is a secondary diagnosis, I should say. And the tertiary diagnosis is asthma. The provider's the one that indicated that. I cannot come in here and rearrange it if that was the case. Perhaps there's proper additional training that needs to happen at the provider level to educate them better. However, I cannot take it upon myself if I'm not essentially a certified coder or biller. It comes from the provider. Now, however, I do want you to be mindful of certain things that you can look out for that will be obvious. Obvious things, that red flags that you know you should not continue to post. So for example, let's say that I'm about to post procedure code 99213 and that I only had one diagnosis code here. And that only diagnosis code is a Z code, a Z diagnosis code, which is to indicate the patient's BMI. For a fact, that is a red flag. If I'm about to post an E&M code, a visit code, and the only diagnosis code that I have is a BMI Z diagnosis code, it's going to look something like this. Body mass index. If this is the only diagnosis code that you have, something that starts with Z, and that's BMI related, and that's the only one you have for this visit code, that's a red flag. That's where you need to stop what you're doing. Do not post this charge, and you'll have to go back to the provider. That's actually a common mistake there when posting charges, that the BMI diagnosis code will not be your primary diagnosis code. It cannot be. Okay? For my visit code here, for my E&M code. So that's where you will close this window, and as I said, go back to the provider and advise the provider to provide additional diagnosis codes. Okay? To the far left is encounter diagnosis codes. Okay, so these are the diagnosis codes that were associated, these three that I'm pointing to here. These are the diagnosis codes that were associated to my procedure code. And the provider does that on the EHR side. They can actually associate up to 4 diagnosis codes to a procedure. However, there's something called an encounter diagnosis codes. Okay? The provider on the EHR side can say that the patient has 8 diagnosis codes. And the number of diagnosis codes that they can pick on the EHR side will really be dependent of the patient's insurance plan. Some only take up to 12, some take less. So the patient might have 8 diagnosis codes for today's visit, but the provider can only associate up to 4 for that charge. So you might come across a scenario where you only have up to 4 here, where I'm pointing to, but when it comes to encounter diagnosis, there may be more. Again, encounter diagnosis, the max will be dependent of the patient's insurance. Sometimes it's 12, sometimes it's less. The order that my encounter diagnoses are in is also the provider's responsibility. If I'm a certified coder, biller, where I can review the provider's note to determine which is today's diagnosis or rearrange these diagnoses, then yes, I can come in here and rearrange my encounter diagnosis codes. But ultimately, it is the provider's responsibility. On the EHR side, the provider has the capabilities of rearranging the encounter diagnosis codes. It's a matter of clicking and dragging on the EHR side. So it should already be done by the time you get it here while posting. Okay? So again, a couple of takeaways here as far as posting 101 is make sure if you're posting the E&M code that a ZBMI diagnosis code is not your primary diagnosis or your only diagnosis. It's something you'll have to pause and refer back to the provider on. Okay. The only time you would really use that BMI diagnosis code is if we're using one of those HEDIS F codes that are BMI related. Whether it's an E&M code or a procedure code, I should not have BMI as my primary diagnosis code. Okay. Okay. So now my next, some other fields that I have here is, for example, units. For the most part, if you have a different unit number other than 1, is because on the EHR side, they have indicated that number. So if your nurse is administering administering an injection, or they're administering immunization vaccines, they may increase the number of units of the service that was rendered. So when they increase the number of units on the EHR side, then you will see it here on the PAMIS side. Charges, you should never be changing charges. This is defaulted. If you find the need to change the charge, I will report that immediately, report it to your immediate supervisor, to your billing department. The charges should already default for you. You should not be changing that. EPSDT, family planning. If this was EPSDT, which is a specific screening done mostly for younger patients, mostly Medicaid as well. So if EPSDT was done during today's visit, I can indicate that here, as well as family planning. So if the service that was provided here is based on the family planning, again, primarily Medicaid, I can indicate that here also. So for the most part, my charge is ready. Obviously, we're going to take a little bit more on this one because this is the first one that we're posting. My journal is right. My insurances are correct. My diagnoses are relevant to the procedure. So my next step here would be to add. Once you click on add, it's going to, if you see it hidden back here in this window, as you can see, the charge that I just added is now dropped to the bottom of this window. My patient has additional charges to post. Therefore, I now need to select the next one. Something else I want to mention here is that you might have multiple data services for this patient. Let's say my patient was seen today and yesterday, but I yet to post either one. When you go to pending charges for that patient, you're going to see both dates of services there sitting there waiting for you to post. When you're posting charges, you're only going to post charges one encounter at a time. Okay? One data service, one encounter at a time. So in this case, it's all the same data service and it's all the same encounter. So I'm going to go through my entire process for all 3 here. So remember what I mentioned earlier, you start with the E&M code first, you then move on to your procedures, and the nebulizer treatment happens to be my procedure. So I'm going to go ahead and highlight that and press select. Now here my steps become easier. Like I said earlier, usually the first one is the more complex one, if you will. But now moving forward, everything else in this encounter is easier as I post. Why? It already remembers the journal. It already remembers the journal that I need to post to, so I don't have to worry about that. Secondly, my ailment is already there. I'm using the same ailment for this encounter, 1 ailment per encounter. So it already knows what ailment to use, and it already knows what insurances I need to post to. Can I still make changes to the insurance? Absolutely. I could if I needed to. But as you can see, it already has in memory that I chose to remove the secondary and only keep the primary. So right off the bat, there's 3 steps already that I don't have to worry about. However, before I click on that Add button here, I want to make sure that my diagnosis is there. Now, as I mentioned to you earlier, unless you are a certified coder or biller, I cannot take it upon myself to make any changes here. However, I want you to be mindful of the obvious. Okay, so we talked about the BMI code, how the BMI diagnosis code should not be a primary diagnosis, right, on my visit and my procedure codes. Another obvious thing to look out for is that the code should be relevant to the procedure. This is a nebulizer treatment procedure code. What if my diagnosis code was pregnancy? That is obvious that it's that it's a mistake. These are so if you're not certified coder or biller, I want you to be mindful of the obvious. So keep your eye out for obvious mistakes because it could happen on the EHR side. So if I'm about to post a nebulizer procedure code, but my only diagnosis is pregnancy, that is an obvious mistake. There should be more of a relevant diagnosis code to that procedure. Okay? Or if my procedure is an EKG, mind you, if you're in the OB department, perhaps that's the case. But if this is a pediatric visit or a family practice visit, and that could you're running the chances that it may be a mistake in those cases. So in this case, I'm going to go ahead and continue. So as you can see on this one, I only have 1 diagnosis code. However, the provider had indicated on the EHR side a total of 3. Okay? Rearranging that is primarily done on the EHR side by the provider. So we're pretty much done on this one. My units stay the same. Nothing else needs to be changed. So I'm going to go ahead and click Add here at the bottom. And now my pending charges pops up again. So all that I have left is my F codes. So these are the F codes that we utilize for HEDIS measures. So HEDIS meaning measures that we need to meet based on what the provider is doing for the patient that day. There's HEDIS measures for BMI, medication review. There's measures also for patients' A1 blood sugar levels. There's also one for their blood pressure. There's different F codes based on what the provider is documenting on the EHR side. And that needs to be posted. And those are the last codes that you're going to post as you're going through posting charges. Okay? All that will be posted, and it goes along to the claim in order for the providers to be compliant for these HEDIS measures. And these in no particular order. I'm just going to select the first one here. Again, be mindful of if something needs to be deleted. If I accidentally have duplication of the same code and they look exactly the same, I can delete. If I have duplication of the same procedure code, but my diagnosis is vary, then I have to ask first before I delete. So I'm going to select the first one. And again, here I am. Everything else will stay the same. And I can press Add. Obviously here, one thing to look out for when it comes to these F codes is that the diagnosis code is relevant as well, a relevant diagnosis code. So if this was an F code for the BMI, there is a F code for that the BMI was reviewed. Therefore, my diagnosis code should have been that ZBMI diagnosis code. So you want to make sure it's relevant. I'm going to go ahead and click Add here again. Now these F codes are going to be associated to a 0 charge. Some centers have it set up to a penny charge. Okay, so in this case, I'm going to go ahead and just click yes because it's okay. If you're posting an actual procedure code of a service that was rendered and you're getting this pop-up message and it says 0, you may want to question it. If it's a procedure of a service that was rendered, for the most part, I should have a charge. So if you don't see one, just present it and notify of that. In this case, it's my F code. We're good to go. I'm going to go ahead and say yes. And here's my last procedure code to post. So I'm going to highlight that one, press select. And I'm just repeating the same flow here until I'm done posting as well. Something else to look out for down here is the profile column. So just to give you a high-level explanation here, my amount column is your organization's full fee, the full fee of that procedure. The profile is my allowable, what I expect this insurance to pay. And that's all based out of setup. So if you see that some of these procedure codes, a real procedure code, not necessarily an F code. If you see some of these procedure codes may not have a profile, again, bring that up. We don't just want to get used to seeing this kind of information. Just present it. Present it to your supervisor, your billing department, and let them know, hey, the patient has Medicaid, plan number MCAL, and I am getting a profile message for procedure code XYZ. Just notify it. Just notify, and it's all based on setup. Maybe it's just something simple that they'll need to fix on the back end, etc. Okay? So I'm going to go ahead and click Add here. This is my last procedure code. It drops down to the bottom. And as you can see, my pending charges window no longer popped up, because this patient no longer has any more procedures for me to post. If I did get, as a quick recap of to what I said earlier, if I did get the pending charges window pop up, but whatever's left is a different data service, different encounter, I need to stop, because I only need to post one encounter at a time, one data service, one encounter at a time. So right now I am done with 515. If everything else was from a different date, then I have to do that next or at a later time. Okay, so my very last step here is to post charges. But as you can see, I have an Edit Charges button down here. So by editing the charge, the system is giving me one last attempt here to make any changes before I continue, if that was the case. So once I'm done, I'm going to go ahead and click Post Charges. So here is my checkout payment window. You're going to get this pop-up window whether you have collected money from the patient or not. So if the patients are paying upfront, their co-pays, deductibles, whatever the case may be, now that I'm about to post, I need to make sure I allocate my payment to this charge. So take a look here at the pre-collected area. My patient has a pre-collected payment of $2. If I collected those $2 today for today's visit, well, I just posted today's visit. Therefore, I have to allocate those $2 to today's visit. And this is a step that is missed often in our organizations, in our centers. This adds to something called unallocated payments, where a lot of centers have an inflated dollar amount to that unapplied, unallocated payments reports. So we want to make sure and be mindful, again, that we are not quick on our fingers, that we're not clicking no, we're clicking on the red X. We need to review that if there is a pre-collected payment, that it very well may belong to today's visit. Okay? Even more so for the centers who have a billing department or a posting department that are not in a different building. Maybe you're even in a different building if you're a poster. You weren't physically there when the money was collected. You may not be very familiar with everything that happened when that patient arrived as far as collecting payments. So you have to make sure to double check the pre-collected to see if it's applicable to today's charge before you move on. So I'm going to go ahead and say yes to this. And the system is now telling me that the patient has the $2 payment there waiting for me to post. Something that we want you to be reminded of is that when we are posting payments, or when we're doing pre-collects, I should say, when we are posting a pre-collect payment in the system, there's a way to add a note in that payment. We do encourage for you to write a note, especially for those centers that have various departments. You have dental, you have family, you have lab. The patient might be making payments to all three. A payment for their copay, their medical copay, a payment for their dental dentures, and maybe a payment for, they're making a payment for the blood work that they just had. By adding a note to that pre-collected payment allows me to easily identify where these $2 should go. So as you can see, this payment was entered with a note that says med visit copay. So now I can easily see that these $2 will be for today's visit. The posted date will probably be the same date of service. So my date of service was 5/15, therefore this one should also say 5/15 essentially, if it did happen the same day. Some of the notes might say copay for date of service. It might say dental copay for procedure code XYZ, etc. A payment for an EKG done on 5/31. So you want to make sure you have notes associated to that payment. That way I am allocating the payment correctly to the right procedure, the right date. So we're going to go ahead and move on with allocating that payment. So the patient paid $2. It's for today's medical visit. So I'm going to go ahead and click OK. And now it wants me to allocate those $2 somewhere. Now it wants me to put the $2 somewhere. Let me point out a couple things to you here. The first thing that you have is the auto allocate checkbox. For the most part, the auto allocate checkbox will be checked. If it is checked, the system is going to try to distribute that money evenly. So if I had different dates, different line items here, and the patient made $20 payment, it'll try to allocate evenly those $20. But usually when a patient pays a copay, most likely it's for their visit. The patient has a managed care plan, they have an HMO, or they have a PPO, and they have a copay to pay. For the most part, that copay is towards the patient's visit. So where should the payment go? On my visit code, on my E&M code. So if you see that auto allocate is distributing your money evenly, then that's when we need to uncheck that box. You're going to need to uncheck that box because now you're going to tell Intergy where to put the money. So again, if the patient is paying you their copay, the copay goes towards the visit code. In this case, it did it for me. It did it right. It put the $2 copay on my E&M code, on my 99213 code. So it did it correctly this time because I only had that one code there that was applicable. But sometimes you're going to see that the system will try to evenly distribute that money. So if that was the case, you're going to uncheck auto allocate. And you're going to click on the box, on the allocate box where you want to put the $2. So the patient paid $2 for today's visit, and the visit code is 99213. So I'm going to double click here and plug in my $2 right here. Okay. Take a look a little further up in blue. It says pre-collected $2. So keep your eye out there. We're starting with $2. 2. We should end with $0. You should be properly applying all your money. We don't want to leave any money there under unapplied if it should have all been applied to this one charge. So I went ahead and put $2. My last step here is to post, is to click on post. So once I click post, it's going to allocate the $2. It's now a receipt. Receipt means payment. So now my $2 is on my receipt column for that 99213 code, and my unapplied went down to 0. It went from $2 to $0. If there were other payments there, it might not be 0. Maybe the patient paid $100 for their dentures. If you're not posting any denture procedure codes, then those $100 is going to stay there. Okay, so be mindful that that may happen. The very last step here after you post your payments is to press the receipt button. The receipt button essentially is a walk-away bill. So when the patient paid you before the visit, we perhaps provided them a receipt for their payment. But now that we're on the checkout phase of the visit and the patient is walking out, leaving from their appointment, I can do what's called a walk-away bill. And the walk-away bill is just a summary of what was done financially for the patient that day, and I can provide that to the patient. It also prints at the bottom any returned to clinic appointments. So if we're also giving the patient an appointment to come back, it will also print the appointment information on their walk-away bill. So I'm going to go ahead and run it. I clicked on receipt, and I'm going to run it, and let's take a look at what it looks like here. Obviously, you can go straight to printing. So here is the walk-away bill. Is an activity, a financial activity of what was done today, the pre-collect payment, any prior balances, and if they have a return appointment, you will see that also. Okay. So I've gone through the motion of posting that one charge, allocating payments, and now I'm sitting back on my pending charges window, where I simply just go to the My Next Patient and follow the same steps again until this entire pending charges bucket is empty. Okay? So now that we've gone ahead and posted those charges, so if your role is to be posting throughout the day, whether it's collecting money or posting charges, at the end of the day, you're going to need to balance your journal. So what I mean by balancing your journal, and I'm going to go back to where we started our training. I'm going to go back to financial journal management. What I mean by balancing your journal is reviewing your journal report to make sure that your payments balance. So if your cash box says that you've collected $100 of payments today, therefore your journal report should reflect the same. Okay? So even though we may have one journal per department, per location, each poster is responsible for running their own journal report and balancing their part of that report. So we're going to go into financial journal management. I'm going to highlight the journal that I'm working off of. And I'm going to go into reports, journal reports. So again, I highlighted the journal that I'm working in right now in the event that there's more than one there. I'm going to come up here to the top, go to reports, journal report. I can actually run my journal report before the journal is closed. I don't have to actually see my report wait to see my report at that time. I can already review it ahead of time before my journal is closed. For the most part, you're doing this step at the end of the day. At the end of the day, when you're about to close that journal and the day is over. Some of the busier locations, you know, perhaps you collect a lot of money in the morning and then you collect a lot of money in the afternoon. Maybe you would just want to look at your journal report right before lunch. Run your journal report right before lunch, balance your morning cash, and then you can do it just to make sure everything's still correct, rather than finding discrepancies at the end of the day that may have happened in the morning. So you can do that. If you do collect a high volume of money, you can maybe balance in the morning. Run the report. I want to be clear on that. Just run the report. We're not closing their journal. Just run the report. Count your money real quick, see if everything's still right in Intergy, and then you'll just do the same again in the afternoon for the entire day. So I'm going to go into Reports, Journal Reports. Pretty much everything here stays the same. For the most part, the only thing you're going to change, and it's a one-time thing, you only have to do this once, is the sort by. It's easier on the eyes if you bubble in post user. If you're sorting by provider, if you are a user, if you are a poster that works with 5 different doctors and you're posting for all 5, the work that you did is going to be all over that report. So it makes it a little bit more difficult to balance that way. But if you sort by post user, you're going to have your own page on that report. So the report will then be divided by poster, and you each will be responsible for your section of that report. Okay? If you pick filters, that's optional. For the most part, it stays as all, and everything else stays the same. So the only thing you really change here, and it's a one-time thing, is bubble in post user. So for the most part, you're just going straight to run. If this is your official last report that you want to print, you can print it out. But you really don't have to print it. If I'm just reviewing it to make sure my money is right throughout the day, then I can just click View and view it on the screen. So I'm going to go ahead and click Run. And this is my journal report. I'm going to zoom in a little bit so we can see a lot better. As you can see here, at the top of the report, it says Post User and my name. So anything I see on this page belongs to me, something that I have done. So now that I say that, something I should have mentioned probably much earlier in our training is if you're sharing computers, please make sure you log yourself out before the next person logs in or uses your computer. We've come across a lot of centers where you may need to be sharing computers. It's now lunchtime and somebody's not going to use your computer. You need to log off, because if you're the one logged into Intergy, but you're not the one physically sitting in that chair, it's going to look like as if you did everything. So if there's a discrepancy, they're going to go back to the person who was a post user, not the one who physically was sitting there. So be very mindful to log off. If you're going to be away from your computer for a prolonged period of time, log off and then let the next person log in. So essentially everything I'm looking at right now is what I did. All the charges that I posted and all the payments I collected. It tells me the patient's name and the dollar amount. If I go to the next page is still me. The next page is still me as a post user, but these are my grand totals. This is my summary page. So if you post a lot, you're going to have quite a few pages before you get to this last page. So this is where I'm really going to use to compare it to my cash box. So if all I did was collect $2, then I should have $2 in my cash box, and therefore it reflects the same thing on my report. As you can see, it breaks it down. What did I collect with cash? What did I collect with credit card? Something else I want to remind you of is voiding. Okay? For the most part, a lot of our centers, the end user itself will not have the rights to void. Voiding means I've made a mistake and I need to correct it. If you've accidentally posted a payment on the wrong patient, for the most part as an end user, you will not have the rights to void that. You definitely won't have the rights to delete it, and you won't have the rights to void it. Typically a supervisor or manager role, for the most part, those are the ones that will void a payment. When your supervisor voids that payment because you made a mistake, I want you to be reminded that that void is going to be sitting on their journal report, not yours. Okay, so your supervisor is also considered a poster when they make changes, or voids I should say. So be very mindful that if I'm running my journal report and it still says that I collected $2, but in fact it was voided, then I need to make sure to look at my supervisor's journal report, because that void is going to be sitting under his or her name. So by running that report under by running the journal report under their name and yours, it kind of helps you balance out there. So be mindful of that. Please remember that if somebody else did the void for you, that void is going to be sitting under their name, not your name. Okay? So I don't want you to start wondering, well, where's the money? I know it was voided. Well, it's on somebody else's part of the report. So I'm clearly seeing that I balanced out. I have $2 cash. My report says $2 cash. I'm good. And that's the purpose of the journal report. Okay? So again, I highlighted my journal and I went to Reports, Journal Report. A couple of things I want to remind you here before I briefly go through the closing of the journal step at a high level there. There's a View Activity button. View Activity. View Activity allows me to see what's posted in that journal. It's not an official report, but it allows me to see what was posted in that journal. One of the main reasons to go into View Activity is this transfer button here. So I want to make you aware that if you have accidentally posted to the wrong journal and you did not catch your mistake on time, again, I have one last attempt here. I can transfer something that was posted to the wrong journal. I can take something, I should say, that was posted to the wrong journal and transfer it to the right journal. So be very careful with that. So when you're looking at your journal report and then all of a sudden you're looking at the report and you realize that somebody else's name is on it, let's not ignore that. If that somebody else works at a different location or a different department, we want to be mindful that that needs to be transferred out of your journal into the right journal. And the capabilities of doing so is this transfer button right here. I will highlight what is wrong and hit transfer. And it's going to ask me to then pick the right journal so I can then move it from here to somewhere else. Okay? My very last step here is to close the journal. And obviously the journal is only going to be closed at the end of the day when everything has been said and done. Everyone has balanced out. All posters in that journal have balanced out. We're done posting for the day. Therefore, the journal will be closed at the end of the day. If a journal is accidentally closed midday, it can be reopened. Okay? If somebody closes the journal at 1 o'clock and we still have half a day's worth of patients to see and charges to post, please notify your immediate supervisor, and it can be reopened. It is actually a practice administration function. You have to be a practice administrator to be able to reopen a journal. So it can be done as well. So closing a journal means that we are done. And a journal has to be closed every day. Okay? Every day the journal is open and closed. Another reason why the journals need to be closed is because something else that happens in Intergy is something called a daily close. The daily close cannot be performed unless the journals are closed. So we need to be very mindful that someone, at the end of the day, when everything has been said and done and we have balanced, that we close that journal. Okay, simply closing the journal is highlighting it and pressing Close Journal. Okay,